I'm Dr. Douglas Reznick from Rocky Mountain Cancer Centers in Denver, Colorado. I'd like to discuss a case like ones we commonly see in my practice. Despite the decline in smoking rates, I still observe many lung cancer patients who currently smoke. Bob is an individual who has a 15 to 20 pack year history of smoking. He was diagnosed with metastatic non-small cell lung cancer, and he was found to have a PD-L1 score of 71%. The patient's tissue was sent for NGS mutational analysis, and the result was quantity not sufficient. The most appropriate next step that I would take with this patient would be additional mutational testing. Options include plasma testing or repeating a tissue biopsy. My approach for Bob would be to proceed with a plasma biopsy with the anticipation that the turnaround time for results will be 5 to 7 days from receipt of the specimen. Those results will then determine if a subsequent tissue biopsy were necessary. If his plasma biopsy is positive for an actionable mutation, I would treat him with the appropriate targeted therapy. If his plasma biopsy is negative, then discussion would follow, with strong consideration to another tissue biopsy for repeat NGS testing. Sequential plasma testing after inconclusive tissue results can help find actionable mutations in patients like this one. In fact, a recent landmark study demonstrated that when patients who were mutation negative by tissue biopsy or had a QNS result, plasma biopsy testing had a 22% increased rate of detection for an actionable mutation. It is possible for a patient like this to have an actionable mutation detected by plasma testing. In this case, an L858R EGFR mutation. In a case like this, when the patient both has an EGFR mutation and is a PD-L1 expressor, guidelines recommend an EGFR TKI as first-line therapy. Furthermore, no immunotherapy is FDA approved as first-line treatment for patients with metastatic EGFR mutation-positive non-small cell lung cancer. This case illustrates the importance of repeat testing in order to fully acknowledge the patient's mutational status.